Hello, everyone. This is Mark Anthony with AI Edge Promotions and Podcast.com. I hope everyone is doing great out there. As you and I know, we have the best of the best doctors and, of course, nurse practitioners. And today we have a couple special guests here. We have Dr. Shannan Ballard and, of course, practitioner Michael Silva. I'm really excited to introduce uh, them today because we're going to be talking about something that's thrown out so simple and so easily without any explanation. So today we're going to be talking about what is regenerative medicine and how it can heal our country right now with people that are struggling with, say, diabetes, neuropathy. I mean, anything you name it. It could be shoulder, frozen elbow. It can even be a pinky toe pain. I had to throw in a little joke there. But anyways, I'm sure pinky too. You guys can work with that. But you can find them at FortisHealthcareSA.com. FortisHealthcareSA.com. The phone number's on the screen. The website's also on the screen. And thank you too for being here.
Thanks for having us, Mark. I
Yeah,
appreciate it.
it's been a long time. It's been a couple years. I think we met over at Dr. Andy Barlow's seminar, which was unbelievable.
Always great to go see him. I think it was
Yeah.
in 2019. We were doing the math a little bit ago. I was like, man.
That
Getting-
long ago. Wow. Okay, man. That time flies too quickly sometimes. I wish I could slow it down. But other than that, what's new with you, and maybe tell us a little bit about yourself and how you got into in regenerative care. And yeah, we'll start with you, and then we'll start with practitioner Michael Silva.
Sounds good. Well, um, this is going to be my 14th year practicing. I'm a second generation chiropractor and
Wow.
proud of it. We got into regenerative therapy actually because my dad is a neurodiplomate. So in chiropractic, we have a couple different specialties, and he does neurology. So that's how we met Dr. Barlow. And then, that just got the ball rolling,
Yeah.
and we dove deep into regenerative therapy. We practice out here in San Antonio, Texas, and we just opened up a new clinic. So we're Fortis Healthcare. This is going to be our second year practicing under the flag, but we've been doing this for a while now. Um, Regenerative therapy, I just fell in love with it because it has the potential to do so many things. It really does. It has the potential to help with the neuroinflammation and autism and joints and wounds, and we do a lot of that. So we are a family owned and operated clinic. We got my baby brother here, Michael, who he'll introduce himself here in a minute too. Um, his wife is actually our brains behind the outfit, and she's our double masters in business, and she really keeps us going. Our nephew, his stepson over here, his our front desk, and we've got our MA on our help their
Wow.
family, and then our medical director. He is like an adopted uncle, but he's awesome too.
Wow, that's awesome. Seems like a family affair.
It really is.
Yeah, it is.
It's definitely
That's
fun.
can't get away from it, huh? Your dad started it all, both of you
He
guys.
really did. He
That's
did.
Absolutely.
awesome. Tell us a little bit about you, Michael.
Yes, yes. Like Dr. Shannon was kindly saying, yeah. So my father kind of started it all, and he is a chiropractor with his neurodiplomat. So I really started out as a young man when I was about maybe 14, 15 or so. I got used to the healthcare, and I'm still young, but
I'm like,
a
oh, that
little
was
bit.
just a couple
This
years
was a
ago,
year.
bro.
This
You're
was a
good.
year ago. No, I'm a little older than that, I promise. But yes, I got started with that, and I became a medical technician. And I wanted to, and then back in, I want to say 2018, 2019, I wanted to get into the nursing field, and I wanted to help patients at a higher level. So I went ahead and obtained my RN in 2022. Afterwards, I went back to school to start with my Master's of Science in Nursing with a highlighted specialty in family medicine. And I obtained that just recently, about 6 months ago. And then I am now pursuing my doctorate in psychiatric medicine because I do want to further my expertise and broaden my horizons. As for regenerative medicine, like Dr. Shannan said, we really fell in love with this regenerative medicine from a wound care standpoint, because I deal with a lot of wounds and I work with a lot of patients that have, especially chronic wounds from, say, diabetes or any of those type of conditions. A lot of these wounds are really, really, they're really difficult to heal, especially if they've had them for so long. So what a lot of this regenerative medicine helps with is to help with tissue regeneration at a much higher level. And we see great results with it. And like she said too, like autoimmune disease, autism, osteoarthritis, things of that nature, migraines. We see really, really, great results with this regenerative medicine from a medical chiropractic standpoint, pain management standpoint, wound care standpoint. So, yeah, it's really absolutely incredible. It really is.
That's awesome. So you were talking about wound care. How do you see regenerative medicine? Like what type of maybe things that you've seen or maybe systems that you guys or protocols that you're using that you're seeing that are healing wounds a lot faster than you've seen in the past?
Well, great question. Great question. So, yes. So, what one big thing that we've implemented into our clinic is the use of wound care grafts, amniotic grafts,
Okay.
as well as injections. But what that does, it helps the patient's tissue heal a lot faster and regenerate much quicker. And when we see that, we see better results. We see less chance of infection down the line. We see less chance of the wound reopening as well. We see less chance of amputation. So yeah, as opposed to just debriding the tissue or doing just what we used to do in the past in the wound care world. So that's kind of just a rough overview of what we used to do and what we are doing now.
And I feel
That's awesome.
Yeah.
So, excuse me, we're going to have to cut this out in just a minute. But Alejandra's back here, and she keeps giving us signs, and I know she wants input. So I think do you think she could fit like right here for us? Maybe.
You guys can do whatever you want. Let's do it. Come on.
Come on over. Because, like
Let's
I
have
said,
some fun.
He's got the goods here. Let's move stuff around real quick if you give us a moment.
Yes.
There we go. Okay. You may introduce and we'll take it from there.
Awesome.
Hi, my name is Alejandra, and I've pretty much worked behind the scenes, but not work at the same time. I kind of just assist, but I definitely have been in healthcare for a very long time. I've worked in large groups in hospitals, and I've pretty much seen it all: the post-surgical wounds, post-surgical pain management. I've worked with collegiate teams and professional teams. I was part of bringing in contracts of two of the major teams here in San Antonio for UT Health. So I do have experience in that level as well. So a lot of the actual collegiate teams and professional teams do use regenerative medicine as the standard of care for injuries, for any trauma that they might have within the sports. So I have seen that as well. So when we talk about regenerative medicine and wound care, it could mean a lot of different things, right? Because you could do the grafts, you could do the exosomes, you could do the PRP. There's just so many different layers, but when you integrate them all together, you just get better results overall. And that's what we have seen, and that's what we do here, because it's not just using one tool. It's using multidisciplinary tools from different disciplines that actually help, because that is what we have seen at a different level, or at not just in research, because I worked at an educational in academia, right, at UT Health. So you do see a lot of different disciplines being integrated, because when you use different disciplines, it actually works better rather than just using one tool or two.
Wow. So what are what's one of the things that drew you to more regenerative medicine and maybe that opened your eyes to it? Aha, there's something here.
So I personally suffer from migraines, and I have literally tried everything in the market. I've tried, um, and I've had them for years. I've had them since I was a teenager, right?
Right.
So they debilitate me. And when I mean debilitate, like I cannot function. Like I am so fatigued that I could be driving and I have to pull over because I cannot drive long distance. Well, anyways, that's neither here nor there. So I've tried everything, right? I've tried all the triptans out there. I've tried chiropractic, decompression, trigger point injections, nerve blocks, Botox, physical therapy,
Wow.
Botox, and I failed it all. Like I have failed it. I've even tried hormone replacement therapy, thinking that that might help, from a functional standpoint. I've tried, the new drugs that come out, and they Nurtec. Nurtec. I mean, I could tell you what I failed, right? And I could keep going, right?
Wow.
And I was very reluctant to try, well, I mean, I've seen the results, so I'm like, okay, I'll try exosomes. And I took it, and I remember I was so fatigued. I was like, oh my God, what did I do to myself, right? I was out for like 3 days. Like I got home and I like slept. I guess
Wow.
it's my own way of regenerating, right? And I remember for like the first time, that first day, I did not wake up with a headache. I was like, oh wow, like this is how it feels to like be normal. This is what it feels like not to be in pain for like years, right? So, but in addition, because I got the IV therapy, as an added bonus, I didn't have any low back pain either. I didn't have any knee
Oh,
pain.
wow.
And like all the other things, playing sports, for 10 years, playing soccer, track, cross country, like, you also do wear and tear in your joints. So I was like, oh, this feels great. I've tried PRP, but this was like a sustained, you know, not cure, but like I could feel the difference.
Okay.
And the nurse practitioner over here, my husband's like, "Did you order your second round?" Because that was my first round, right? I did it in December, and I was like, "Okay, I'm going to do it." I'm like, so I told him, "You know what? I'm waking up with the headaches again. It's already been past, like, because you have to do like a protocol, right? So after, I think I'm 2 weeks overdue, 3 weeks. I feel the difference, and I'm like, okay, can you please call? We need to order like now, like to come and get it on Monday and Tuesday, because I did feel a difference. So I personally have tried it. I've personally, have those chronic debilitating migraines. So I could say that they are working. Of
Right.
course, everybody's different. Everybody, nothing's guaranteed in medicine. But from that standpoint, when you've tried everything, when you've done everything, like, that standard medicine has, that's approved by insurance companies, like, what do you do at that point? Like, where do you turn? Like, what do you do? And had
Wow.
I known, I mean, like now I know, but had I known when I worked and that was like, the standard of care when I worked with professional teams, like, why didn't I just try it myself at that point?
Correct. What helped? Like which therapy? Because there's different types of therapies. Was that the IV that you noticed that
The
helped a lot?
IV exosomes, yes,
Okay.
yes, that's what
And,
helped me.
okay, and you said you were getting these like 2 or 3 times a month?
Oh no, like 2 or 3 times a week.
Oh shoot.
No, you would go through months where she'd have them every day.
Yeah.
And then she'd call me and say, "Hey, I can't do anything. I'm in a dark room. It's cold. It's
Right.
quiet. I can't.
100%.
I can't live." So, and
Yeah.
like she said, she tried so many things, and we have different protocols. So with the exosome, she's only on her going on her second treatment now.
Yeah.
But we usually start out with them closer together, and then the treatment starts spreading out as you go along. So she hopefully should have more than just a month's worth of headache-free days the next time
Okay.
these.
So would you say from 10 being headache strength and migraine strength to so much pain, where would you say you are at right now from 10 to 1?
Like currently, like right now, I'm probably about a 5.
So, okay, about a 5.
But
And
I was like at a 1, 0 with like because I do have like a lot of other issues. So I don't have like I didn't have that inflammation, hot, like you can literally feel the heat coming off my neck from like when I had a migraine.
So before you had the exosomes, what was the number that you started at?
Oh, I was like a 10 constantly. 8 to
okay.
10, constantly on a constant level.
Mhm. Yeah, here in South Texas, it would get super hot. She'd be like, "No, I can't go outside. Like, no way."
So like I had to rearrange my lifestyle like a lot, like to the point where I couldn't even work where I was working at anymore because I couldn't perform what I couldn't.
Wow. Wow. That's amazing. So you're saying IV treatments has helped you, and what else? With I is there a booster connected to that, like something else that you're connecting with that?
Well, yes, you do the actual the IV exosomes, and then you add on the actual injection portion to the actual localized area. Not you just don't do it intravenous, but you also do it to like let's say if you need it in your neck, you do it to boost that area in addition to the IV at the same time, so simultaneously.
So
Oh
with her
wow.
specifically, what we did is we did an IV round of exosome, and then in her neck, like suboccipital around the posterior cervicals, we did the mesenchymal stem cell injection to those tissues. And I think that, and then conjunction with continued chiropractic care and continued exercise, continued decompression, and then some, lifestyle and dietary changes here to kind of boost her to
Yeah.
get, the best that she can.
Well, the mesenchymal cells, how long do those last?
Well,
What do you mean?
Like when you do it, is it a one-time thing? Is it every 7 months?
It depends on what's going on, right? So for joints, it could be one and done, but it really depends on what.
The person.
Yeah, it depends on your person. It depends on the damage that's done. It depends on the
post procedure instruction. Did you follow as well? Like you don't.
Are they compliant?
Are they compliant?
Okay,
So for her
wow.
specifically, since we're doing some neural inflammation damage control here,
Perfect.
she's going to be doing a few more rounds where, I mean, looking at her history and everything, we're probably anticipating maybe up to 5 rounds of these exosomes. Because, I think in the United States, we're so used to fast, quick results, and we're always looking for cures for things. But you have to take into account all the other traumas and micro traumas that are bombarding you environmentally and things that you're taking into your body too. So I call ourselves the microwave society. So you put food in the microwave and it's done like this. But
Right.
there's no process that does not require time. And this, we're looking at I don't want to throw out the word cure, but a potential cure. Hopefully, we want to make sure that her symptoms are regulated and decreased. And since she's had this for most of her life, it's going to take longer to heal.
Mm-hmm. That makes a lot of sense. And I like what you said, each person's different. It's not like, oh, well, this is what's going to happen. Like I could take just Exozone, and that might just help me. I understand migraines very well. I've had them my entire life, and I'm just like done. Like I actually knew at the end of the month that I was going to get hit for 2 or 3 days that I'd be out for no work and dark room. And then when I started to change my eating, and then I did an exozone, by the way, I did do an exozone at
Oh.
Barlow's, and I noticed that everything changed. I haven't had, if I get a migraine now, it's normally because of stupidity of stress, letting stress, eat me up instead of like breathe. It's going to be okay. You can't change, you can't change the circumstances, just what's around you. But within that, what would you say? What are some of the stuff that you love in your practice, Dr. Shannan? That you're seeing in regenerative medicine and people getting healed or people getting better. they were at a 10, now they're at a 1 or a 2, or it's gone. Like some of the things that you've seen in your practice with regenerative medicine.
Well, aside from Alejandra here, we've had many years. We did a lot of knee specialty treatments in the past, and that's really what my dad started with. I came in to practice with him around 2012, and I think it was 2013 or 2014 that we just pulled the trigger and started doing knee mesenchymal stem cell treatments.
Okay.
But we've seen people that, had contemplated pretty much everything but a knee replacement because they were either scared to go in their knife or they just
Weren't candidates.
weren't candidates, yeah, or they couldn't afford it. So we've had people come in also with athletic sports injuries, so torn ligaments or torn meniscus. So my mom was one in particular that she really wanted to take my niece to Disney World with my dad. And so, you always got to look at the why behind things too. And that was her big why. And it was just so sweet. But how long before they went to Disney did she hurt her knee?
It was like 6 to 7 weeks, I think.
Yeah, 6 or 7 weeks. She couldn't get out of bed. She called me. No, she didn't call me. My dad had to call me and say, Shannon, get over here. Your mom's hurting. And
Wow.
yeah, she was in a wheelchair. She couldn't straighten out or bend her knee. It was just locked in a certain position. Long story short, she did have a bucket tear on her meniscus. So her meniscus was torn, but not completely. And she was just in excruciating pain. So we called up the stem cell. We got them in, overnighted them, and we gave her an injection. And she was up and walking around all of Walt Disney World with my little 8 or 9 year old niece. And she was out there for a week? And so in about 4 to 5 weeks, she was able to get up and walk Disney World with her granddaughter.
And that's not a small walk.
No.
No, you might as well just say you better prepare for a marathon.
That's why I got
70 miles.
that's why I got the exosomes, because I didn't want to be, and I mean, on the way over there I was hurting, like, because we drove, and I was like, I would tell him, like, can we please stop, like, I just can't, just it hurts, like sitting down positions too long gets my migraine going. So I can't stop my life, but I have to modify, right, what you do and how you do it. So I wasn't going to take that experience from our daughter. Like, I had to push through, which, every other person in the world has to sometimes when you have kids, right? It doesn't matter if you're sick or you have the flu, you still have to take care of the kids.
Yeah.
So, that's no easy walk. That is a lot.
Yeah, that was a lot of walking.
Do you feel, well, Alejandra, thank you so much for answering those great questions. And I'm glad that you're getting better, because from one migraine person to another, I'm with you and praying for you, just because it's just and sometimes they just pop up and they'll be gone.
Yeah, out of nowhere.
Yeah, out of nowhere. I'm like, I'm thinking, what did I eat? Okay, I have too many. Did I have sunflower seeds with salt? I'm like, my diet. I'm just like,
well, not even that, but sleep has a lot to do with it too.
Oh yeah.
If you don't get up, if you get up when you're before you're when you're normalized to, or what you're used to, you already wake up with a headache.
If the medical director calls you in the middle of your REM, is that what you?
I know. And I know this one, Alejandra, where you go to sleep to get the migraine to go off, and then you wake up and you realize you still have it, and you go back to sleep.
Yeah. Or what what's great what the worst is, like when you're about to go to sleep because you need that relief, and you forget to put your phone on do not disturb. That is the worst.
That is. I know. And then you're getting mad at the phone when you're like, dude, I just gotta. And then I'm like, I'm all talking to my phone off.
Yes.
Wow. Well, man, I'm glad you're getting better. So, Michael, when you've seen the change with the migraines and everything, I'm sure it must be a blessing to have each other, because you're more, I bet Michael's probably in learning mode. Okay, what else can we do? Well, I can just tell just by,
Yeah, yes, absolutely. Yeah, great. Yeah, great notion there. So yes, Alejandra, every time, she would, get these migraines, or every time that she would, something would happen to her like that, I'm like, man, you know what? How can we get her better? And, I tried, referring her to her, getting her into a PCP clinic, getting her on medications, like she said previously, triptans, Nurtec, and these are all, topiramate, anti-seizure. I mean, all kinds of these drugs, and they just weren't, they would maybe work just a little bit, but then long term, they wouldn't touch her migraines. Mm-hmm. And I remember I was like, why don't we just try some exercise? Let's give it a shot. You know what? But what's the worst that could happen? And I'm glad we did.
Don't. We've been trying to talk her into it for like 3 or 4 years.
Tag team it.
And she finally listened to him.
I think it
She should have came to me. Let's put that.
It was just like the unknown, right? You see these people doing it, and you see that they got results, but they're like, okay, well, that's joint pain. Like, how is that going to help me?
Mm-hmm. Yes.
Well, I think also, so to kind of tangent on that, another thing that really pushed you to it was we had another patient that we did exosome and stem cell on, and we were running some special, so we got her like really, really quickly in on it. But she had back pain. She has fibromyalgia. She's been on gabapentin for almost a decade. And then, all this stuff's been coming out, and all this research has been coming out that gabapentin can increase your likelihood of getting Alzheimer's. So I know that really scared her. Anyway, she came in and we did the stem cell injection to her low back, so both SI joints, and we did an IV of the exosome on her. And I mean, this woman, Lord bless her, we've known her as a patient for probably 6 or 7 years.
She's family.
She was one of my parents' patients.
Yeah.
And so she's had knee pain. She's has like fibromyalgia, just it gets you in so many different places. It's any fiber can be inflamed basically.
Right.
But she's had a lot of headaches too. And we gave her the injection and she came in, I think it was 2 or 3 weeks later. And I asked her how she was doing. And she's like, oh, good. I still have some back pain. But she told me she like moved and she said, oh, my pinky just moved and it didn't hurt. And then she's like, you know what? I've had a horrible headache for 2 weeks. And this is the first day I haven't had a headache. Wow. And then she came in the next week and she's like, I haven't had a headache. And then this was back in October, the beginning of October, and she hasn't had a headache since. So, and she's had very little fibromyalgia flare-ups. And I know, when did you got your stem cell in December? So I think in December, I finally just pushed her over the edge, and I told her that I was going to get stem cell for her. But we've been seeing these awesome results with patients in all different areas: fibromyalgia, headache, joint pain, the wounds. Another really cool one is COVID-19 and long COVID symptoms. Mm-hmm. And they're coming out with more research now, even on PubMed, that it's helping with the cytokine storm and the it's helping with the acute respiratory distress syndromes. Mm-hmm. So COPD is another one. We have someone that's going to be coming in and we're going to be doing a nebulizer treatment for COPD.
Wow.
Yeah.
That's amazing. What a lot of people don't realize, they hear I can't even say it, mesenchymal cells. I wish we just leave it at stem cells. It's so much easier, but that's another story. Mesenchymal cells. Yeah, I know that's another one.
But you want to know what actually pushed me over the edge? That I finally had to pull the trigger. So my rescue medicine that had helped me for years, right, was Tylenol. That's the only thing that helped me. Yeah. And I want to say a couple of weeks before that I finally pulled the trigger, I actually developed Steven Johnson syndrome with Tylenol for taking it for decades. So I was actively dying, like, 'cause I would take so much Tylenol because it would hurt so much.
In case you don't know, for the audience, like it's a really bad rash. Started getting a really bad rash,
and I didn't know what it was, and I started getting the flu symptoms,
and your fingers were peeling.
Yeah, my fingers were peeling.
Skin was peeling.
So I was like, okay, and I was like, okay, if I can't take Tylenol, like, what am I going to take? Like, I can't take ibuprofen; doesn't work for me. So, I had to do something since I couldn't take Tylenol anymore, and none of anything prescribed medicines were working. So that's why I'm like, okay, I'm going to do it now.
Wow, that's it's interesting. I was taking all the extra strength, and I knew that it was tearing up the lining in my stomach, because a lot of people don't realize it when you take a lot of like Tylenol and stuff like that. But one thing that I will say that does help, that I've noticed for myself, my mom got me onto it. Mom's always got these remedies.
They do.
But it actually, some of these stuff really work.
Yeah, they do.
They like
do.
If you can go to the store and get Alka-Seltzer, but get it with quinine in it.
Yeah.
There's something in the quinine, and let me tell you something. That stuff, it helps a lot. So it got to the point, I don't do it really anymore, because I used to get migraines where I was basically not able to get out of bed for like it was 3 times out of the month. And now I get a migraine maybe like 3 times out of a year, which is a lot more normal. But yeah, the quinine actually works pretty good. And another one, I don't recommend this, but I'll say it is, it works. Um, you just, I do the orange Alka-Seltzer. I know it's not great for your stomach, but the orange Alka-Seltzer, I would take that and it would take it away. I don't know. I don't know.
That's
But
interesting.
these are my little things that over the years, and Alejandra knows, you figure certain things that start to work or work a little bit, whatever. Those were my two go-to. And sometimes when I start to feel a little pinging, I'll just do
because you feel it when it's gonna come on.
Yeah, it's the ping. It's like weird, and then it's like I'm like, okay, uh-oh.
Yeah.
Yeah, because the pinging is gonna go pop,
or like you're doing something and you're like, oh, I'm gonna pay for this.
When I see the pinging, I'm like, oh shoot, I got about 45 minutes till I'm jacked, so I gotta figure something out. You know what I'm talking about?
Yeah, I do, because it's funny, because I actually do.
Yeah, Or you start feeling, I'm getting a twitching. I'm just joking. but yeah, wow, amazing. Dr. Shannan, what would you say right now where you see regenerative medicine going? And do you see that there's still a lot more restraints on it? What are your thoughts on that?
Yeah. So we live in America, right? Where we have, I'm like,
that's all you have to say. We're done.
We live in America. No, so we have the FDA, the Food and Drug Administration, right? So they put a lot of, they have great pros, but then there's some cons too. So they have some rules and regulations that are really there to keep us safe. But I feel like, I got to collect my thoughts, because that's a really deep question, So the FDA has actually approved a couple different stem cell treatments. One is one used to be for wound care, and then there's another one for pediatrics that's actually for tissue regeneration or rejection, so tissue rejection. So seeing that the FDA is actually more open to that makes me really optimistic. What was it? Was it TRICARE West had actually...
TRICARE West, yeah.
Yeah, they had approved, the FDA, it was working along with, some different insurance companies. And Aetna and TRICARE West. Was it not Medicare too?
No.
Okay. Again, brains here. So the FDA had cleared a couple different stem cell injections for joints to be done for, I believe it was like knees. Was there any specific ones?
It was like considered under like extended coverage.
Mm-hmm. So like I said, that makes me optimistic that there might be more coverage and, just more
acceptance.
Yeah, more acceptance of these stem cells as we get going. And, you know, in the past, a lot of people were scared because they thought it was when people, stem cells is such a buzzword. People would think that stem cells were aborted fetuses. So, you know, we don't want to do that. I don't want someone else's tissues in my body and I'm going to get the AIDS, you know? It's not a laughing matter.
Yeah, but you know what? No pun intended. Let's take the vaccine. I won't go there.
Oh.
You know, like
Yeah, I said it. You didn't.
But yeah, you know, FDA regulates these mesenchymal stem cells as biologics right now. So it's considered kind of the same as blood and tissue transfer. So that's why a lot of these the stem cells, they're at the blood and tissue banks.
Mm-hmm.
And I really think, I don't know, I'm optimistic for it. I think that it's going to get more tread, that we're going to get more acceptance, that I think people are really starting to come around to see the power that these stem cells have.
You know, I'm a little optimistic about it too. So you're not the only one. The good thing about not being a doctor is, and this is good as in I'm actually saying I'm speaking for just other people, not saying for yourself, is that when you have the FDA, it looks good. It looks great, but they're treating a symptom that's being prolonged to get worse. They're not there, and I'm saying this, not you. They're not there to, they're there to sustain what they can get out of the wallet. And I speak up on that all the time. And I'm praying that with the whole Trump administration, that they can get those barriers off, because we need to focus and get back to the basics, the whole body, and give. If I see a neuropathy patient and I'm a doctor, let's look at the whole body, not just, oh, the foot. Let's look at the gut, the toes, everything. And what can we do to heal you or get your life better, to where I'm not having to give you a pill to give you a pill to give you a pill and then you're dead. And that's what I'm seeing. I'm not saying for you. I'm saying that's what I'm seeing, and it needs to stop. And that's why I think with people like yourself that are the heroes out there wearing the capes that people don't see, are focused. And that's why I love regenerative medicine. And that's the main reason why I even do the shows, because of Dr. Barlow.
Oh yeah.
You know, he inspired me.
He's awesome. Dr. Barlow's he's just
shut out, Barlow.
He's a force. He really is. But you know, you're absolutely right. And like I said, you know, there's the two sides of the coin. And I think, okay, I am a provider, and I'll say it. I hate insurance. But as a society, really, as a country, we're just in the mindset of, oh, if insurance covers it, then I'm okay with it.
Correct.
And I think there really needs to be, insurance just needs to be completely redone. It needs to be brought back down to the foundations and just redone. But I think if people can see that, like you said, we're here to help your whole body. And medicine's become so specialized that you go to a primary care physician and all they can do is refer you to that specialist and refer you to this specialist, refer you over here. And you go to the specialist. Oh, that's not me. You got to go to that specialist.
To the subspecialty.
And you're like,
I worked there, so I've
there's
seen
A
it.
subspecialty.
so many doors, so many doors. But I think with the FDA approving stuff and then insurance kind of following suit, it's kind of just opening the door for the public and for those that are still attached to the insurance to open their eyes a little bit more. And I think that we are opening our eyes, you know, especially with this administration and Robert Kennedy Jr. in there. I think he's really for the people. He really is.
Yeah.
So
I agree.
I could jump on, because since I'm, I understand the insurance. Insurance is not there to take care of your health. They're there for profits. Look at their Q4 and Q5 profits. I mean, Q4, Q3, they don't care. They're going to do what is the most effective, evidence-based that helps. What is that? Steroid injection. But you're limited to three a year because it's that bad for your body, right? And if you want to do these exosome stem cells, they're considered experimental, but they don't want to cover them because they're really expensive. I mean, I get it. It took me a while to pull the trigger just because, but I'm so desperate now to get it again. I'm like, I don't care what it costs. Just call them, please. Like, I need it. When you've tried everything and you have spent thousands and thousands of dollars on nerve blocks, on Botox, for all these treatments, all these medications, all these doctor's appointments, and it's not just the money, it's your time. You have to go and travel to these places and see if this new therapy is going to really help. I mean, if you really look at the time, energy, and effort it's already, still cheaper than if you do something that it's going to actually work. And this regenerative medicine, well, yeah, is it the cost of a steroid injection? Well, no. But are you going to do what the insurance tells you when the person who's making the decision is not even a provider?
Now they have AI making all the decisions.
That literally deny 80% of your claims.
Mm-hmm.
Yeah, the only way you can go see a doctor now is, I'm dying.
Yeah.
And even then,
unless you're in San Antonio, you can come see
No,
us.
or they'll be like, "Are you sure?"
You have same-day appointments.
No, you're right though. It's sick care. It's an abomination. It's terrible.
Yeah, but when you go to the bigger systems, yes, they pay for that branding. They pay a lot for that branding. But how long does it take for you to get an actual appointment? I could tell you from the top of my head how one of the surgeons that I worked with had a 5-month waiting list.
Mm-hmm. Well, and I think
urologists 7 to 10 month waiting lists.
Mm-hmm.
Psychiatry, there was one fellow, 18 months. Yeah.
But I think also as a provider, when you are kind of in the web of insurance, you're really hindered and you're bound by what they will cover. So we're with insurance, and I get that part, but we also have, the other stuff like the stem cell that aren't covered. So we don't feel afraid. We feel empowered. We can tell you what we really think is the best option for you. Versus like, oh yeah, just go get a steroid shot. Here's some ibuprofen. Go get what else? I don't even know all the medication. We don't. We're in pain management, but I don't give the medicines. But like I'm saying, we feel like we're not afraid to tell people, hey, here's the research.
Here's it.
Yeah, no, here's what we've seen personally with our own eyes in our clinic. This is what I professionally think and know will help you. And don't let money or insurance be the hindrance and dictate exactly what you're going to do with your body,
No, I agree 1,000%, and this is just me, and I'm not here bagging on insurance because I know insurance works for real important stuff like your eyes, like, if you have
all of my body's important. I don't know about you, Mark.
You know what I mean? Well, what I mean by that is I'm talking about the important stuff when it comes to like, I'm in a car accident or something like that. I mean, 100%. But when it gets to the whole, right, the whole pill thing, I think for me, it just kind of gets me a little leery because it's like, okay, after I'm done with this, what's the next one I got to take from that? Once it stops wearing off, then I have to get another one. I'm just saying that I feel like we just need to get back to the basics. Is when can the healthcare get back to the word? Says health.
Yeah, absolutely.
Get people back to the health. And it's sad because people are catching on. It's sad when they're like, well, the only stuff that really is going to even help me is that's not what's not on my insurance. When I'm hearing other people say that.
Mm-hmm.
And it's cash out of my pocket. Yeah. And it's like, yeah, but you know what? It's worth it if I want to get better.
But you're paying $8,000, in deductibles plus premiums every month and every year. So, let's weigh our options here and let's see what's really going on,
Wow. Yeah, that's a whole nother story. We better jump. We need to,
Another
we need to,
podcast.
hey, I'm like, we need to jump off that. We keep getting coming back.
Yeah.
But on another note, right now, are there any new regenerative stuff that you see that are maybe kind of coming down the pipeline that you're maybe excited about, or that you're maybe just seeing? What'd you say?
Oh, I said there's one that I'm really excited about, but
Yeah,
it
go
is.
ahead.
Oh, hold on, excuse me. I have my alarms to pick up my kids. No, there's one that I'm actually really excited about. So I do have a special needs boy. He's 2.5. His name is Theodore, our little teddy bear. But he was born with congenital cytomegalovirus. And for those who don't know, because even though I'm in medicine, I had no idea what it was.
Girl, I had to
It's
look it up. I blame.
yeah, exactly. So it's kind of like mono, but it is a virus that I got when I was in my third trimester, and it affected him. And it affects you neurologically, the development, the his vision was impaired, his hearing's impaired. So he's a couple things that are stacked against him, but then he also was born. Like at the very beginning when cells were just starting to replicate, he like part of his jaw is smaller and then one of his ear canals is a little bit smaller too, but that affects brain development and speech and swallowing, and just motor and developmental, right? So mental delays. And we're seeing a lot of really cool things happening with the regenerative medicine and autism and mental illnesses and mental impairness is what I'm trying to say. So one of my friends, he actually was treating a boy that had mental impairment and autism, and he was reading at like a first grade level. And this boy was probably in ninth or 10th grade, I want to say. And he did 3 different exosome IV treatments. And I believe it was over 6 or 9 months. And after the third one, they found that his reading level went from a first grade level to a 6th grade level. And this is in less than a year. In less than a year for a boy who's been struggling and
Wow.
dealing with this for his whole entire life. So at 3 years old, at 36 months, you're a candidate to start, we can start treating the kids. And he's 2.5. And I keep telling my husband, I'm like, 6 more months. Teddy's his nickname's Thor. So,
Love
the
it.
god of
Thor.
thunder. We're like, Thor's gonna fly, man. Thor's gonna fly. So we're really excited. I'm really personally excited for that aspect of it.
And
That's awesome. How long
practitioner
have you
Michael,
three
the
been
one that's
working
actually,
together?
yeah, and practitioner Michael, the one that's going to administer it. So we're super excited about that.
Yeah.
Wow. So you guys just a whole bunch of tag teaming over here.
Yes.
I actually got an exosomes myself as well. I remember I got it done to me. I think it was maybe in 2018 I got it done to me. And yeah, I mean, when I got it done, I got a lot of energy when I did it. I remember I woke up at like 4 a.m. and I'm like, man, I wanna work out. I'm gonna do jumping jacks and cartwheels. But yeah, it is I think it's incredible medicine. It really is.
Well, that's awesome. I love the fact how you guys just work together as a team. I think that's the important thing, and it's that family, that camaraderie, which I totally love, and I think that's what we have to do. If someone is down,
Oh, I'm sorry.
just like that right there, huh?
Yeah. Man down.
Yeah, we got a man down, we got a piper down. But when someone's down, you get together and work together, and I think that's beautiful. And I can see why your practice is doing well. And I'm excited. I love your shirt. Is that your guys' work shirt or?
It is. It's one of our Fortis Healthcare shirts. Because we can do all things through Christ who strengthens us. Oh yeah, unashamed over here.
That's beautiful, man. It's one of the first scriptures I taught my kids, man.
Really.
That scripture right there. But I just want to say thank you three so much for coming on, and it was a joy. And maybe it was like too easy to just talk with. It's like talking with a friend at a coffee shop. I love that.
Yeah.
And
Thanks so much for having us, Mark.
Thank you.
Thank you.
yeah, I could see us doing this again because I'm already kind of some ideas kind of popping up in my
Oh yeah.
in my little brain. But maybe I'll just take an exosome shot and I'll make it bigger. I'm just joking.
We
No
would
pun
love to be
intended.
back. We'll get a better setup here.
Yeah, I'll
instead of
just get
on the
yeah.
phone.
Yeah, it's all good. Hey, the phone worked for right now, and you know what? It's the message.
It
I
is.
think that's what it is. And those of you out there in internet land, if you're struggling with whether it be neuropathy, frozen shoulder, any type of body pain, and you're taking painkillers and you're just sick and tired of being sick and tired, and you feel like you've tried everything, I would really recommend for you guys to check out Dr. Shannan. Go to fortishealthcaresa.com and really look at regenerative medicine and why not? Invest in you. We are our greatest investment, and we don't want to treat our investment like it's an insurance. So again, thank you so much. And if there's anything that you would like to leave with the viewers, what would that be? Any of you guys? Yeah, it could be all three of you, whatever.
I would say, fortis is Latin for strength. And we're here. You want to revive the strength within you.
Yep.
Well, that's good. That's real good. Come on, Alejandra. I know you got something.
It was her idea.
Yeah.
Oh, you want to do a little jump on that? What would you like to say to people that are struggling with migraines right now and they've just kind of given up?
Oh, absolutely. I mean, if you've tried everything, if you've done everything your insurance company has told you, and it's still not working, call us. We're here. We have
I love it.
Professionals who will be able to help you, because we personally have gone through that. They personally have to put up with me.
I love it. And Michael, the nurse practitioner who is becoming a doctor, what would you like to say on that?
Yes, I would say, saying kind of like what Dr. Shannon was saying, like revive the strength within you. And we all know that we can do all things through Christ that gives us strength. He is the great physician.
I love it, guys. That's just beautiful. Hey, yeah, those of you who are out there, we're having church right now. So if you want to repent and give your life to Jesus, you might as well the time is right. What the heck? I mean,
Ben's coming now.
I'm too much, guys. Anyways, it was a blessing, blessings and blessings upon your guys' business and the hands that you guys touch of other people, that they get healed. And thank you guys so much. I appreciate you.
Appreciate you. Thank you.
Oh, yeah.